all. I hope you're doing well. So, I've been meaning to make this video for a long time because I feel that as a medical student, it's my responsibility, to talk about this. And today we're going to talk about depression. So, what exactly is depression? So, depression is not a normal condition, है ना, जिसमें कि हमें अच्छा नहीं feel हो रहा है because our brain health or our mind health is not doing well. Now, a lot of people talk about depression very lightly कि मैं depression में हूँ या फिर ये depressed है. Well, everything is not depression, but let's say कि if you have persistent symptoms for 2 to 3 weeks at a stretch where you're either sleeping too long, sleeping too less, you have anxiety probably, your sleeping pattern is very awry, you are having probably suicidal thoughts, और लेट्स से दैट यू डोंट फील लाइक डूइंग एनीथिंग जो आपको पहले पसंद था. लेट्स से आपको बैडमिंटन खेलना पसंद था या आपको कुछ और पसंद था एंड यू आर नॉट एबल टू डू दैट. ठीक है, तो दे कैन बी डिफरेंट वेज ऑफ diagnosing, and there are different symptoms to depression. So and specifically there are two basically types of depression. एक होता है reactive मतलब कि आपकी लाइफ में कुछ हुआ है, जैसे फॉर एग्जाम्पल अ लॉस ऑफ अ मतलब लव्ड वन, किसी की डेथ हो गई है या फिर आपके मार्क्स कम आए या फिर you've lost a job or maybe some other stressful event which is basically making you sad. The other and more troublesome is endogenous depression. Now, endogenous depression is something where a person is innately depressed, मतलब उसको कोई रीज़न नहीं है डिप्रेशन का, बट वो दुखी भी नहीं है, मतलब वो लो फील कर रहा है फॉर नो रीज़न. ठीक है, एंड चाहे कैसा भी हो, चाहे उसकी लाइफ में सब कुछ ठीक चल रहा हो, चाहे उसके पास सब कुछ हो, पर फिर भी उसे वैसा फील हो रहा है. सो नाउ देयर आर मल्टीपल थियोरीज टू डिप्रेशन. एक है कि डोपामाइन की कमी हो सकती है, दूसरा कहता है सेरोटोनिन की कमी हो सकती है, तीसरा कहता है कि देयर आर न्यूरोट्रोफिन फैक्टर्स, एंड इट कुड ऑल्सो बी बिकॉज ऑफ अ प्रोलॉन्ग्ड इलनेस या सर्जरी. उसकी वजह से समथिंग कॉल्ड साइटोकाइन स्टॉर्म, मतलब टू मेनी इन्फ्लेमेटरी पार्टिकल्स इन द बॉडी बिकॉज ऑफ सर्टेन इंजरी ट्रॉमा फॉर अ लॉन्ग टाइम. ठीक है, बट दैट इज नॉट द मेन गोल ऑफ द वीडियो. द मेन गोल ऑफ दिस वीडियो इज टू टेल you that if around you somebody has been diagnosed with depression and let's say they are not doing well, so you should never tell them कि तुम्हें क्या जरूरत है डिप्रेस होने की, तुम्हारे पास तो पैसा भी है, तुम्हारे पास तो गाड़ी भी है, तुम्हारे पास तो ये भी है वो भी है. We all have some things in our life and we also have some things that we don't नेसेसरीली हैव बट हमें चाहिए. मतलब जैसे सबकी लाइफ में कुछ कमी है, कुछ अच्छा है, सो वी ट्राई टू काइंड ऑफ ऑलवेज कंपेयर आवरसेल्व्स टू द अदर पर्सन कि अरे तुम्हारे पास तो ये है, मेरे पास तो है नहीं, मैं तो डिप्रेशन में नहीं, तुम क्यों. सो दैट इज द वर्स्ट थिंग टू से टू समवन. सी एनी पर्सन डिस्पाइट ऑफ हैविंग एवरीथिंग कैन बी डिप्रेस्ड, है ना, ऐसा कुछ नहीं है, बिकॉज इट कुड बी एंडोजिनस, इट कुड बी समथिंग एल्स दैट यू डोंट नो अबाउट. सो हाउ कैन यू help somebody who's in depression? One, if you know that somebody is not doing well, please recommend them to see a therapist or a psychiatrist who can give them medicines and who can take them into therapy so that they do not suffer for longer, and basically you can help them out. Two, if they are not able to financially support themselves through therapy, because therapy sessions can be a bit expensive, so maybe as a birthday gift, as an anniversary gift, or even as a gesture, you can probably give someone a couple of set of therapy sessions. I think this is the most underrated gift that somebody could give to you, है ना. Third is that be there for them. I mean, see, when you question somebody na ki why are you depressed, that is the worst thing to say. Usse acha just hear them out, just understand why they are feeling that. Don't invalidate their feelings because that is how they feel. I mean, they are not trying to justify it, they are just telling you that that's how they feel, so you need to accept it that that's how they feel. ठीक है. Fourth, don't question the fact कि you might feel helpless, that कि यार मैं क्या करूँ. The idea is not to feel helpless, the idea is to understand that they are going through that, and maybe you just being there is more than enough. Trust me, as somebody who has been depressed endogenously for at least 3-4 years is what I understand. I don't expect anything from anyone, honestly. I just want the other person to be there for me, listen to me sometimes, and understand that I may have highs and lows. See, another fact about people who are not doing well mentally is that समटाइम्स दे मे नॉट पिक अप योर कॉल, समटाइम्स दे मे नॉट रिस्पॉन्ड टू योर मैसेजेस, कभी कभी हो सकता है वो आपसे रूडली बात कर रहे हो. सो प्लीज डोंट टेक इट पर्सनली, बिकॉज ऐसा नहीं है कि दे आर नॉट रिस्पॉन्डिंग क्योंकि वो आपसे नाराज है ना. ऐसा इसलिए हो सकता है क्योंकि वो खुद ही परेशान है. मे बी जब आपने उन्हें फ़ोन किया या मैसेज किया, दे आर नॉट डूइंग वेल, उनकी उनकी हिम्मत ही नहीं है, उनके अंदर एनर्जी नहीं है टू रिस्पॉन्ड. सो डोंट टेक ऑफेंस from people who are not doing well mentally. And you know, I think the best way to deal with somebody who is depressed is just hear them out and be there for them in whatever way they feel better. Yeah, please share this video with somebody whom you think will help from this. And take care. If you are somebody who's not feeling well, do go and see somebody. Government hospital में जाके at least एक therapist या psychiatrist से बात कर लो. If you're in Delhi, RML hospital and IBAS has psychologists. You can actually go there. It's free of cost. Even AIMS has psychologists. तो आप जा सकते हैं, आप दिखा सकते हैं. Psychiatrist हर government hospital में. You can go and interact with them. So, and also if you're somebody who's depressed, please eat well. Please don't do any kind of smoking or alcohol, because that kind of makes it worse sometimes. And exercise is very important. Connecting with nature, writing down your feelings, and doing things that you like, spending time with your loved ones if you like that, and staying away from the triggers that actually make things worse for you. ठीक है. So these are the self help things that you can do. And yeah, take care. Bye.